first, give yourself, a moment to admire the view from here. It's hard to beat. I'm Denis Wirtz, the Vice Provost for Research at Johns Hopkins University, and really just delighted to see you all here. So, distinguished guests, colleagues, students, members of the Johns Hopkins community, a warm welcome also to those joining us from throughout DC and beyond. It is truly my honor to welcome you all to this special event celebrating the 2024 President's Frontier Award recipient, Dr. Joseph Sakran. The President's Frontier Award represents almost distinguished universities' commitment to support faculty whose work transcends boundaries and has the potential to fundamentally change the field. Each year, this award provides substantial funding to empower our most innovative thinkers to pursue their boldest ideas, allowing them to explore uncharted intellectual territory and accelerate discovery. We are profoundly grateful, of course, to our donor, Mr. Louis Foster, whose generous investment has made this award a reality. His vision and commitment to advancing innovative research continues to create meaningful impact across our institution. So tonight, we're celebrating, as I said, Dr. Sakran, whose groundbreaking work exemplifies the spirit of this award. As the Executive Vice Chair of Surgery and Director of Clinical Operation of Surgery at Johns Hopkins Hospital, Dr. Sakran has distinguished himself not only as an exceptional clinician, but also a visionary researcher and advocate. Dr. Sakran's accomplishments are truly remarkable. His research has revolutionized our understanding of trauma care systems and emergency response protocols. His data-driven approach to public health challenges has provided crucial insight that influence policy and practice nationwide. And his ability to bridge the gap between clinical medicine and public health advocacy demonstrate the kind of interdisciplinary research and thinking this award was designed to recognize. The President's Frontier Award acknowledged not just past achievement, but future potential. Dr. Sakran's innovative perspective and demonstrated leadership gives us confidence that his work will continue to evolve in ways that benefit society and advance knowledge. In a few moments, Joe's program chief will formally introduce him and invite him to share insight about his work. Following these remarks, we'll hear from an esteemed panel of legislators and policymakers who will engage in a thoughtful discussion on gun violence as a public health issue and explore various policy approaches to enhance community safety. This conversation will examine evidence-based strategies, legislative frameworks, and collaborative initiatives that can address this complex challenge facing our communities across the nation. The transformative work we celebrate tonight exemplifies Johns Hopkins' highest aspirations to develop knowledge that serves humanity and to foster leaders who use their talent to address our most pressing challenges. So thank you for joining us again to this important evening, and I now turn the program over to Johns Hopkins Chief in Surgery, Dr. Andrew Cameron.
Much appreciated. Thank you, Dr. Wirtz, and thank you all for being here this evening, especially the panelists. I'm Andrew Cameron. I'm a transplant surgeon at Hopkins and the director of the Department of Surgery. And it is my pleasure to introduce to you a member of our faculty, Dr. Joseph Sakran, as we hold this dialogue on an issue of critical importance to our institution, to our city, and to our country. Joe has been leading and pushing this dialogue for 2 decades professionally, and of course, even longer if you know his personal story. I remember very well learning that Joe had been selected for the President's Frontier Award and being immediately happy for my friend. And then my next emotion was what an appropriate validation the award was of the importance of this issue to our communities. In fact, it is every day inescapable in the most tangible way possible. Lives lost, potential lost, futures wasted. So officially, Dr. Sakran is a trauma surgeon in the Department of Surgery. He's from Northern Virginia, did his surgical training at Inova, and then his trauma fellowship at Penn. He has a master's from Bloomberg and another from the Kennedy School at Harvard. Joe is a lot more than just his degrees and training. He is currently our executive vice chair in the department and our vice chair of operations. But some of his most important work we'll hear about now, and that is maybe his personal story and his journey, but also how he serves our city and our country as we are confronted with a public health crisis, one that I hope can be pushed forward this evening with the dialogue on gun policy. Joe. All yours.
Well, good evening. It's great to be here, and you know, it's truly an honor to be the recipient of this award. I still kind of think back to that day that I couldn't understand why Andrew kept saying to me, "Are you coming to Grand Rounds this week? You sure you're coming, right?" And I'm like, my gosh, I am a man of my word. I told you I'm coming. And needless to say, I was absolutely shocked as I saw what was kind of unfolding. And you know, to be honest with you, it's humbling in a lot of ways, one of which is there are so many tremendous individuals that exist across the ecosystem of Johns Hopkins University. And just to think that, you know, the work that we have done, and it's not just me, it's really, as you're gonna see, a collaborative effort that cuts across sectors. To think that that work has been recognized in this way is so special. And maybe now more than ever important, considering the ecosystem that we are functioning in. And I just, you know, you'll notice that this is a little bit of a different type of, usually after the award, the person that receives the award, they give, I guess what's called the President Frontier Lecture. Dr. Wirtz can correct me if I'm wrong. And I figured no one wants to hear me speak for an hour. And as Ren and I were talking, and we're, you know, the whole team kind of coming together, we thought, what better way to discuss an issue that cuts across disciplines, sectors, than to bring together a group of experts that could really highlight it in the most appropriate way. So I'm just gonna briefly talk for hopefully less than 15 minutes, just to kind of give you a little bit of a sense of how I got here, and why I'm doing the work I'm doing today, and just highlight some of the stuff that we've done. I just, of course, want to thank, you know, the Provost and Vice Provost, and everything, you know, all of your teams that have gone through so much to put this together and to continue to kind of recognize faculty. It's really a tremendous honor. Thank you very much. So I think it would be inappropriate if I didn't start with, and I'm just going to stand back here because I can't see that screen and the sun's in my eyes. So forgive me for being way behind the podium. But I want to start by recognizing the other finalists, right? I was lucky enough to be given this award, but we have Dr. Patel, right, who is an associate professor of electrical and computer engineering, Dr. Johnson, associate professor of biology, and Dr. Faria, an associate professor of radiology and radiologic sciences. And I just want to congratulate them on being finalists and getting that far. I'm sure their work is tremendous. I've looked up a lot of the stuff that they've done, and proud to be among them. I can't begin telling you this story of how I got here without explaining what drove me into medicine. And it really started, honestly, at Inova Fairfax Hospital. I was born at Inova Fairfax Hospital, which is just a stone's throw away from here. Born to the son of immigrant parents that came to this country in search of those hopes and dreams that I think so many of us strive for. And I think what no one ever predicted was at the age of 17, I would go from being this healthy high school senior to collateral damage after I was shot in the throat with a .38 caliber bullet. And I start with this picture of Dr. Bob Ahmed, my trauma surgeon, and Dr. D. Mukherjee, my vascular surgeon, because it was these two individuals along with their teams that provided me with this second chance, this opportunity to be able to understand how sacred life was, and the blessing to have a second chance to be able to be here with you all today would not have been possible without them and their teams. And so I'm so grateful for them. I'm, of course, grateful for also the people that have been by my side through good times and bad. And, 2024 was great, of course, because not just because I got the Frontier Award, but most importantly because I married the love of my life, Francesca, who is, as you can tell, I married up in a lot of different ways. And she has just continued to push me and to be there. And I'm so proud of her. She serves as Chief Innovation Officer for Governor Wes Moore. So, baby, thank you for being here. As Andrew said, I went back and I trained at the hospital where the surgeons operated and saved on my life. And this is a whole separate story, but I can't even begin to tell you what it's like to operate with the surgeons that operate on you. And at times I was so nervous, my hand was shaking so bad that, Dr. Mukherjee says, "Joe, did you take your Parkinson meds?" And, because you wanted to show up and be the best that you could be for them. It was tremendous. And as I finished, I ended up going to Penn, where I really began to understand the systematic care of trauma patients. And as I was going through this process, I started to realize that despite how good we think we are as a trauma center, despite how any one of us, Dr. Cameron or myself, think we are as surgeons, if someone comes in that's shot in the head, there is very little that I can do to bring them back to baseline. And it got me thinking about the preventative aspect of what we do. And it's why, I think about this motto at the School of Public Health, where it essentially says, saving lives millions at a time. This reflects both the opportunity and the responsibility that we have to think beyond the trauma centers, beyond the operating room, to really try to work at what I call this nexus of medicine, public health, and public policy. And as I started to kind of, think about, I'm just a doctor, I don't know about any of these things. How do I kind of build my skill set? I ended up going to the Kennedy School, which actually is where Francesca and I met 10 years ago. And I started to understand the importance of political will and the importance of narrative, and how do you not just do the research to get the right data and science, but how do you communicate that data and science so people like Congresswoman Kelly can really resonate with it and understand why it's so important. And we're gonna get to her in a second. In the most positive way, of course. But so I started going through this path, and then I realized that I didn't understand the practical aspect of, how to actually the sausage gets, made. And so I ended up spending a year through the National Academy of Medicine and the Robert Wood Johnson Foundation in the U.S. Senate, and that was a transformative year for a variety of reasons. I was working for Senator Maggie Hassan from New Hampshire, who serves on both the Help Committee and the Finance Committee. I think a lot of you probably recognize that those two committees essentially comprise healthcare legislation in America, so very important committees. But what was really fascinating about that year was that I started in September of 2019. You can imagine what happened, right, a few months later. And in fact, the week that I joined her office, I remember her lead health policy advisor, we were having this discussion, and I said, hey, should I say something to the boss about, this virus that everyone's talking about? And he said, okay, but one sentence, because, time is limited, and we all know that. The next week, everything was off the table. And, I got to be and kind of a small part of some historic legislation that was taking place. And it was a fascinating experience that I was able to really kind of understand how not to just have the right idea, but how do you have the right strategy and approach? Because it requires both of those components in order to be successful. And so I know a lot of you probably are very familiar with this public health crisis that we're going to talk about in this panel discussion. But just to highlight a few things, over 120,000 people a year are either injured or killed. It is literally the #1 cause of death for children and adolescents. And when you think about, right, there's this common narrative that people think, guns make you safer, right? A lot of people get guns because they say it's for self-defense. But the reality is that access to a gun in the home increases the risk of suicide, right, by 300%. There's all of these factors that are multifaceted and that we have to really be able to talk about in a way to understand how do we tailor solutions to this issue in a way that allows us to navigate all these different components, whether it's unintentional injury, suicide, homicide, and so forth. And when I think about this, it really comes down to, and this is an oversimplification, but it comes down to easy access to firearm. When you combine that plus different factors, whether it's impulsivity or suicidal ideation or dementia, that can end up in a very detrimental place. And so when I think about this issue, I love this graphic that was from one of the BRADY events that really illustrates that there is no one person or one organization that's going to solve this. It takes all of us, and that's why we have this panel here today. Healthcare professionals are an important part of that. I think a lot of you understand what happened in 2018 after the NRA came after doctors. And frankly, we are the ones that are at the center of this issue. And I think for the first time, we were able to demonstrate to Americans, by the stories that we told and the pictures that we showed, what we were seeing on the front lines. And that led to a lot of different things, like a number of summits to the American College of Surgeons, but it also led to an incredible corporation of this is our lane through BRADY. And in full disclosure, I'm the chair of the board and the chief medical officer. I put that up front just so, right? But so we incorporated this as a way to be able to work with healthcare professionals as one of the different arms of this movement. If you look at organizations like BRADY, right, we work with military men and women, we work with gun owners, we work with healthcare folks. It requires all of us. Now, this issue that we face, right, part of it is the stuff that's happening at the federal level. We're going to talk a little bit about that. But most governing in America happens at the local and state level. And that's why, when you think about what's happened in Baltimore, there has been a tremendous effort by Mayor Scott where he put together a $50 million plan to really have a comprehensive violence prevention effort. And Jen knows, of course, a lot about this, having just left the School of Public Health, and we're going to get to her incredible work right now at the state. But in 2018, when you think about the issue of ghost guns, and I'm highlighting this for an obvious reason, they seized about 12 in 2018. That number in 2022 peaked at 516. And so BRADY helped Baltimore City, right, file a lawsuit against Polymer 80 and was able to hold them accountable. And in fact, the successful lawsuit that was a major, Polymer 80 is a major ghost gun manufacturer, resulted in a $1.2 million judgment and a ban on sales to Maryland residents. I think some of you might have heard about ghost guns yesterday, right? Because the Supreme Court yesterday upheld the federal regulation banning ghost guns. And what's interesting is this is a conservative court, right? In fact, it was written by Justice Gorsuch. I think the point here that I want to make is that even in what seems to be divisive times, there is a lot of commonality that exists among us as Americans. And finding those opportunities where we can actually move the needle forward is so critical. Because I think if you talk to any responsible gun owner, they will tell you that, yes, you should undergo a background check. You should have a serial number on a firearm. Now, what's interesting over the past 4 years is there's been tremendous strides and movements in the right direction as we think about what happened under the Biden administration when it comes to gun violence prevention. And we're going to talk a little bit about this, but one of the things that a lot of us pushed for, even before President Biden was elected, was a national approach to violence prevention by having a White House Office of Gun Violence Prevention. And, you know, for those of you that have been kind of living and breathing this, it took a while for it to happen, but a lot of work, people in this room and beyond, came together to really put together this office that was not just led by government officials, but brought in incredible people like Rob Wilcox and Greg Jackson, right? Survivors, people that have been impacted by this, that understood the issue, to really drive home some of the different things that were happening, not just at the national level, but at the local and state level. And this was, of course, put together in 2023. Now, the office, no surprise, doesn't exist anymore. And that's part of the problem of having, you know, an office in kind of the executive branch, and we were talking about this before the session started. But it led to a lot of other things that we can't forget, which is 12 statewide offices, including one in the state of Maryland. And we're lucky to have Jen with us, who is executive director for the Center for Crime and Violence Prevention and Intervention, and she's going to be moderating this discussion. Now, for decades, we have been pushing for people to recognize this as a public health crisis. And it's not, you know, of course, you know, just myself or Brady. It's so many people across the movement. But it's also people like Congresswoman Kelly, who not only has been pounding the pavement on this, but also even had a bill trying to get Congress to essentially force a Surgeon General to write this report. Well, I think a lot of you know that these reports are important because they're widely respected publications that take an evidence-based approach of the most urgent public health issues. And what could be more important than an issue that's the leading cause of death for children and adolescents? And so we were happy to see that the Surgeon General last year finally put out a report after a lot of effort, a lot of work, and this work existed from, you know, people in the movement, it existed from the White House Office of Gun Violence Prevention, and so many others. And I think this report was very impactful because it highlighted things like the impact on youth, right? And how it was a leading cause of death for children and adolescents. But it also highlighted very important factors that often don't get discussed, which is how gun violence impacts not just the victims, but also the families and the communities. It permeates throughout. And that was something that really had to be said. Now, interestingly enough, if you go to the link, it doesn't really exist anymore, but fortunately for us, this was written in pen, not pencil, so it can't really be erased. I will say the comprehensive approach that has happened has resulted in a historic decrease and decline in gun homicides. We have seen that especially in places like Maryland, but all across the country, and you can see how this parses out. I think this demonstrates that the programs and policies that we have been working on actually make a difference, right? And they have been making our communities safer. So I just want to end very quickly by talking about the narrative piece, because I think sometimes as healthcare professionals, as researchers, we get very stuck on the data and science. And, you know, as Kris has heard me say many times before, the data and science is critical, but the data and science doesn't change the hearts and minds of people. And it reminds me of, you know, Professor Gans, who's probably the world leader in public narrative, that talks about it in the terms of the story of self, the story of us, and the story of now. And his point is that if you want to go from value to action, it's done through emotion. What does that mean? That means being able to tell your story, getting people to understand why this issue is so important. And that's what we've been doing in a lot of different ways, and I want to highlight two things. One is the Show Gun Safety Campaign. So Brady has worked with the entertainment industry to really try to think about this in a little bit of a different way. So we know when you look at other public health issues like smoking and car crashes, right, there has been intentionality in how we have approached those issues. Some of the solutions are short and medium-term kind of solutions, but some of them are long-term as we think about social norm change, behavioral change. So working with the entertainment industry, what we have been doing is trying to get them to incorporate principles of responsible gun ownership. So for example, if a police officer walks into a home, instead of putting the gun on the desk, they lock it up in a safe storage box. That's one example. Think about, okay, what happens when an actor gets in a car? What's the first thing that they do? They put on a seatbelt. That's not a coincidence. That's baked into scripts. So the team has been working with showrunners and writers and directors in pre-production phase to be able to incorporate those principles. And, by the way, if you are going to show someone being shot, then show the real carnage. Show them what actually happens versus someone that gets shot, they pop out a bullet and they're walking off, right? Which we see all the time. So this is just one example. The second is, and I think this is important because there's a lot of different ways for us to engage in this issue. And this is just one of the ways. There was a couple of us as clinicians, Dr. Sarani from GW and myself, that worked with journalists from the Washington Post to demonstrate what these AR-15 bullets are doing to bodies. And this was a phenomenal piece for a variety of reasons, one of which was it showed the real damage that happens, but then the reporters, they worked with parents of children that had been actually killed in mass shootings, and they used some of their real pictures. Because often a lot of Americans are desensitized to the carnage that's happening. You hear people say, oh, it's just another shooting. So this was a really, I think, tremendous effort, so tremendous that it actually ended up winning a Pulitzer Prize. And it's phenomenal to think what a difference it makes when you say, 40,000 plus people die a year of gun violence versus you actually show them what happens. I just want to leave you with a couple quick things. There's a couple P's that I live by in my life. And the first is purpose over position. I think it's important to kind of, stay grounded to what you're doing. There's a lot of red shiny lights out there. It doesn't mean you have to grab all of them. And that's something I always kind of keep telling myself. You also have to be passionate about what you do. Now, the problem is, as my wife always tells me, I'm very passionate, but passionate people are not patient, and patient people are not passionate. And so I'm trying to work a little bit on that. But patience is important because you need the patience to be able to transcend the adversity that we all face. And that's the perseverance, right? Regardless of what anyone in this room is interested in, health is so interconnected to so many of the social issues that we face in America, whether it's gun violence or immigration or climate change or structural racism. And in order to be able to be effective, you gotta be able to build the trust. The trust is so critical. And that's something we've been trying to do a better job of in Baltimore. Because the people that understand the solutions, it's the people that are closest to the struggle, the people in the community. And by bringing them to the table, not after you've come up with the ideas, but as partners to figure out what those ideas are, that's how you develop those type of relationships that allow you to get the buy-in and the trust to make a difference, to be able to make communities safer. I want to say that, to receive, kind of this honor this past year, so much has changed since last year. And I think when trust in science and institutions is being tested, it makes it feel less like a personal milestone, and I think more like a collective moment of resilience. I have, I think, stood at literally and figuratively at the front lines, at the bedside, in the Senate, in city halls. But this award isn't just about, my work. It's about the belief that science, when rooted in compassion and courage, has the power to transform. And I just want to highlight, I can't highlight obviously everyone, but just a few people that I think I could not be more proud to be part of Johns Hopkins at a time when we have such incredible leadership here. And I will tell you, like, there's so many people to this, but like, you know, Andrew, Dr. Cameron, I should say, man, this guy, he doesn't just talk the talk, he walks it. He shows up, he grinds, he does all of those things. And the most important quality that he brings every day is empathy. He has a level of empathy that I just think is sometimes hard to find. And despite how difficult, you know, the situation is, he is always willing to find a way to figure it out. Not just for himself, but more importantly for the faculty, and most importantly for the patients that we always keep at the center of what I do. So I'm so proud to work for Dr. Cameron, to be part of the Hopkins ecosystem. And I will just leave you real quick before I introduce the panel with, Dean Stanson's wonderful, I think, quote that I recently saw, which is, "A researcher's idea is like a seed. The university is the ground where the seed is planted, and the NIH provides the water and sunlight to help it grow." And as you know, Hopkins has a big effort around research saves lives. I think it's so important. We have to collectively figure out how we come together to, transcend the adversity that we're all facing. And so with that, I want to quickly introduce these incredible panelists. Obviously, Congresswoman Robin Kelly doesn't need any introduction, right? She's dedicated her career to public service as an advocate for Illinois families. I think, you were elected in like 2013, and she's worked really, I think, on a variety of things, but one of which is gun violence prevention. And she has been, I don't know how many pressers we've been at together, but she has been such a staunch advocate for responsible gun ownership, for making communities safer, and has been unapologetic in her approach to this. And just so grateful to have you here. Of course, my dear friend, Kris Brown, who is the president of BRADY and has really, I think, transformed the organization in many ways that you're going to hear about. And just glad to have you here, Kris. And last but definitely not least, our moderator, Jen Polikonanis. I knew I was going to mess that up. I'm sorry, Jen. She said it's phonetic. But she recently left the Center for Gun Violence Solutions at Johns Hopkins Bloomberg School of Public Health. And now she is the executive director for the Center for Crime Violence Prevention and Intervention at the Maryland Department of Health, has a tremendous wealth of experience around gun policy, but just is also a wonderful human being. So excited to have you all come up and have this panel.
I'm so honored to be here, and I hope that all of you are going to indulge me for just one moment, because I am so excited to be here with all of these champions and all of you as we actually work towards solutions, which is really what we need. I am from Baltimore, and as many of you may have heard, sometimes we call that Smaltimore. And none of you know this, but actually Dr. Sakran and I share a small world connection, which is that he grew up on the same street as my now husband in Northern Virginia, 4 houses down from one another. So Northern Virginia, as he said, Fairfax County, safe neighborhood, lots of families, doctors, lawyers, accountants, military officers, federal workers, lots of federal workers. So it was a safe neighborhood, protected neighborhood. But of course, gun violence touched this neighborhood when Dr. Sakran, at 17, was shot and injured at the high school that both he and my husband went to. And a year before that, there was a young woman who lived just a few houses down from Dr. Sakran and his family, next door to my husband. She was a young woman who had just graduated from Princeton with honors, 21 years old, new officer in the Army, and she was shot and killed 1 year before Dr. Sakran was shot. Mm-hmm. And now some people would say, small world, what a terrible coincidence. But I would say that is an indication of the public health crisis that is happening in our country still to this day. And so as we come together to talk about this issue and work towards solutions so that we're not talking about our stories of gun deaths and injuries, but we're coming together to talk about stories about our families and accomplishments like this award here today, I would love to hear from each of you what you are doing to address this issue in your spheres, from the public health approach. And maybe we can hear from Representative Kelly first and then go down the line.
Well, first of all, good evening, and I'm honored to be on the panel with all of you. These two I've worked with a lot. In some ways it's sad. We've had to do so many pressers together. But I came to Congress in 2013, and I wrote the first congressional analysis of gun violence prevention in Congress and had, suggestions, and we everyone contributed to the report. Unfortunately, we had to update it 10 years later because, people were still dying. I have many pieces of legislation, and sadly enough, because of the environment we're in, I don't expect our legislation to be called, but we did ask for gun violence to be looked at as a public health crisis, and finally, Dr. Murthy did do that, but also we have legislation around keeping guns out of the hand of dangerous people, and legislation around accountability if your gun is lost or stolen, that you need to report it. My Brandon's in the back that works with me in all of this, but numerous pieces of legislation. And we've been pushing and pushing and pushing, frankly, I'm going into my 13th year, for these pieces of legislation to be passed. And right now, we did pass, with help, the bipartisan bill on guns, but we're just hoping that this administration doesn't try to pick some of the things off, because the $250 million toward community violence intervention is very, very important. And, we're just hoping, I know he pulled apart the Office on Gun Violence Prevention, but hopefully the states will all keep their offices. So those are just some of the things.
Yeah, thank you so much. Kris?
Well, I echo Congresswoman Kelly's thanks for all of you for being here, and just a special shout out to you for being such an incredible champion in Congress and really leading the way and thinking about gun violence as a public health epidemic. For us, I'm very lucky to have someone like Joe Sakran, Dr. Sakran, as chair of our board, not only as a survivor, as a trauma surgeon who has an MPH as well. I can't list all of his degrees, he already did that. But thinking about gun violence as through a public health lens, to me, includes obviously policy at the federal and state level. You're never going to get something accomplished that really addresses the issue comprehensively without legislation being the backbone. And I have to say, as the head of BRADY, the evidence of that, of course, is found in the BRADY background check system itself. It stopped more than 5 million sales of guns to prohibited purchasers. So there are individuals all over this country walking around alive today who are with us because of that law. Super important. But you can have all of the best laws in the world, and if you don't enforce those laws well, you're not going to have the impact that you need. And so I think what we really did accomplish through the Bipartisan Safer Communities Act that President Biden put into effect is unprecedented funding to help implement laws across the country. Just 2 examples there, Jen, something that's near and dear to your heart. Extreme risk protection laws. Those exist now in 20 states and counting, including Illinois. But people need to know that they can have a firearm removed from someone who is a danger to themselves or others in order to use the law. So it provided money. We are the preferred provider for the state of Illinois, for example, in its Pause to Heal campaign, to move up the awareness rate from around 10% in Illinois to 80, 90%. It means lives saved. And then lastly, culture change. Joe touched on this, but if you look at any public health epidemic, the way that it's addressed and solved is better policy, better enforcement of the law, cultural norm change. That's why show gun safety and actually having the TV shows we all watch. You know, there's some fans of White Lotus. There's episodes featuring firearms. Show gun safety is a part of that, right? A huge number of shows that are out there today, the script writers are coming to us, and it may be small and incremental, but it's massive in terms of a shift in how people perceive the role of firearms in their everyday life. And it's the same with our End Family Fire campaign. We have more guns than people in this country. If everyone locked up their guns tomorrow, we would cut gun deaths in half the very next day. It's really that simple. So the education and culture change component of what we do as a movement is very important.
Thank you so much. And as we, talk about the public health approach and all of these solutions, because really at its foundation, the public health approach is just actually using data. It's using research to develop programs and policies that work. And talked a little bit about community violence intervention programs, and those are a really great example of policies that work. It's the public health approach because they're based in evidence and data. And so, Joe, I'm wondering if you could talk a little about what are community violence intervention programs, how do they work, and then I want to talk a little about how we can support those at the federal level.
Yeah, so it's such a great question because I think it gets to one of Kris's points, which is when you think about the public health approach, there isn't, one solution that's going to fix this. And community violence intervention programs really focus on trying to tackle the root causes of gun violence. And what's interesting about that approach, and I think about places like Hopkins and the work that we do through our Break the Cycle campaign, it's really wanting to shut down that revolving door of violence that we see. And it's done by engaging credible messengers, right, that starts, of course, we're talking about those that are non-fatally injured as an example, in the hospital, but then extends beyond the four walls of the hospital to think about things like housing insecurity, food deserts, education, jobs, and so forth. And it really requires an investment in the community, which we saw, by the way, right, through the Bipartisan Safer Communities Act, to really be able to build these type of programs that are tailored specifically to the region that you're in. And I think in Baltimore, we have really seen this firsthand. Interestingly enough, we just left a JAMA summit with people from all across the country discussing this issue. And one of the things that came up is depending upon how you resource these programs, depending upon how they're structured, they may or may not be as effective. And so that's why, to your point, Jen, the data is so critical. Like if we don't have the data, if we get rid of the CDC Injury Center, all of those things, right, will prevent us from really trying to build a robust evidence-based understanding of where do we invest, how do we invest, and who are the people that need to be kind of on the front lines doing this work to try to ensure that we're reducing the recidivism that we're seeing in places like Baltimore.
That's such a good point. And these programs are local programs in hospitals, working with those who've been injured by gun violence to make sure there's not retaliatory shootings. Escalation, when there's, beefs happening in the city, de-escalation of that to interrupt violence before it turns fatal, harm reduction. But of course, here we are, with the Capitol in the background in DC, and you touched a little bit on why that federal support is so important on data. And Representative Kelly, I wonder if you talk a little bit more about what can happen at the federal level to support these local and state initiatives that are vital to these communities.
What can happen negatively?
Yeah, fair.
One thing I also wanted to say onto what you said about community violence intervention programs, they have the right messengers, because that's important to the people that are survivors or, maybe they're relatives of survivors or things like that, and respected on the streets. That I know in Chicago that has proven to be really, really important. is very concerning now because the way budgets are being shredded, frankly, and people are being laid off. We're very concerned about what's going to happen with programs like community violence intervention. And what I've been saying to everyone, and not trying to be political or anything, you cannot stay on the sidelines. That we need to hear everyone's voice that is passionate about this. And we don't want you to be patient. We want you to speak up. And the thing about the medical community, you are so respected on both sides of the aisle, and you do save lives. So it's very important that people in the healthcare community call your senator or your congressperson to let them know how important this is. We have to, advocate and agitate a little bit, also. But that's what helps us. That's what's going to help us keep funds in the budget. That's going to help us pass maybe even more legislation, possibly. Because the thing is, my district is urban, suburban, and rural. This is an urban, suburban, and rural problem. As you guys know, this can happen anywhere. I know there may be more places it happens more often, but when I think about Chicago, it's not the mass shootings, even though some of that is happening, but it's 3 or 4 people, but it's the one by one, daily, everyday shootings, and, 8 years old, 10 years old, very, very, very young children. So you guys speaking up, that's what helps us. Hearing from people, from all walks of life. But I do think that doctors, nurses, people in the healthcare field, people who take care of the people that haven't died. We always talk about the people that died, but all the people that haven't died, and how their lives have changed forever and their families' lives have changed forever, and reminding them of people like you who lived and went on to become a wonderful doctor, and doing the research that you're doing. How many people have we lost that could have been wonderful doctors or congresspeople or whoever, parents, how we've lost so many people. So we need you, frankly.
Yeah, and we need you.
You got me.
So, we're talking about the reality of the situation. There is a big partisan divide, right, that we can all acknowledge. But there are opportunities where we can still have progress. And, talk about what's supported by public health and evidence, safe storage, talking about child access prevention, right to gun ownership and responsibility to prevent theft and accidental shootings and suicide. Kris, I know that BRADY does a lot of work in this arena, and I'm wondering if you could talk a little about what is possible in this realm as it relates to, safe storage and responsible gun ownership.
I touched on it a little bit. Obviously, for us, thinking about the fact that we have more than 400 million guns in this country, and understanding that about 8 kids a day are killed or injured with guns in their own home, that of the 44,000 Americans who die every single year from gun violence, about 2/3 of those are suicide. And as Joe rightly noted, the presence of a loaded and unsecured firearm in the home increases the risk of suicide by 300%. So that's very, very substantial. And then the other component of it is, if you look at these horrific shootings that occur across this country, which every day we have the equivalent of a mass shooting, so much underreported, but about 76% of school shooters get their gun from a home where it's not safely stored. So if you think about those aggregate lives lost, and as you note, Congresswoman Kelly, also the fact that we have a huge number of people who are shot and survive and carry trauma for the rest of their lives, we have to think about the safe storage piece, because if we do that, we can end the 8 kids a day who are killed or injured with guns in their own home. We can substantially de-risk suicide in that home if we safely store the firearm. Every public health research, and this is where research is so important, actually the act of having that firearm safely stored materially reduces suicide risk in that home. And then think about the school shootings that would be eliminated. So why is that so important? Because we can save a lot of lives. But the interesting thing is, the National Rifle Association, founded at some point in the 1800s around gun safety, I go to their museum and their bookstore. You're not going to find them talking about safe storage. They used to. That's what BRADY has really claimed as a primary educational mechanism. And you know what? With our End Family Fire campaign, what we find, and we have over 5 billion views of our ads. We're doing this with the Ad Council. You've probably seen our ads. We hyper-penetrate, especially in gun-owning households and in redder states where many of the guns are. But you have a 56% increased likelihood to engage in safe storage if you see our ads. That is a tremendous shift in thinking, and it shows me two things. One, the opportunity for education here is huge. People aren't, when they go buy firearms, it's not often that they're also sold a safe with that firearm. Let's shift that. Let's change that. Let's change the way we think and get back to the roots and origins, really, even in the 1700s, around firearms, which is the elemental aspect of safe storage and accountability and responsibility related to gun ownership. And that is a cultural shift, it's a paradigm shift, and it's something that I think if we did across this country would be so critically important.
Yeah, I totally agree with that. And I think to kind of your point, at a time when things are so divided, safe storage is something that there's a ton of bipartisan support, not to mention responsible gun owners agree, right, that we should be safely storing our firearms. Yet, despite that agreement, we see all those statistics that Kris mentioned. And, you know, it's interesting, in young people, like the adolescents, it's not just the 80% that are getting it for the school shootings, it's also in the suicides. Yeah. We have seen over the past decade, typically when we think of suicides, we think of older white men. That's typically the demographic. Over the past decade, we have seen a tremendous increase in the suicide rate for Black, Latinx, and Asian teenagers. And guess what? 82% of those young people, they get the firearm from the home, typically. So there's all of these different measures that I think we can do in a way that is nonpartisan, that responsible gun owners agree upon, that can really make a difference, like tomorrow, in reducing injury and saving lives.
Can I say something? One thing, people think that, it's bleeding heart liberals that talk about this, but in our gun violence prevention committee, Mike Thompson is the chair. He probably has more guns than people in this room because it's his hobby. And there's other gun owners that are a part of that, but they're responsible gun owners. And I just wanted to tell you, you two just gave me an idea. I'm going to go to my Black radio station that lets me do PSAs, and I'm going to ask them, can I do one on safe storage, and repeat the stat you guys just said.
See,
Thank you.
I love it. Real conversations, real solutions coming out of it. Yeah.
There you go.
And as we talk about safe storage, also it prevents trafficking. If you safely store your gun, it can't be stolen from your home, it can't be stolen from your car, which means it can't be diverted to the illegal market. And when we talk about illegal trafficking, that's another incredibly important issue. We're sitting in D.C. I'm living in Maryland. Representative Kelly, you're in Chicago, and these are all states with strong laws, and yet they aren't islands. And so, let's talk a little about the importance of how do we prevent illegal trafficking, and what are some ways that we can address that?
Well, it was because that's my thing, trafficking and store purchasing. In fact, when I was a state rep many moons ago, that was the first piece of legislation I passed in Illinois to make the penalties stiffer for those who store purchased. And but that was in the legislation. But as you said, there has to be the resources behind it so it can be enforced. But that is a big problem. Chicago does have strict gun laws, but if no one else around you, and we're surrounded by Indiana, Iowa, Missouri, Kentucky, Wisconsin, and actually since I've been in Congress, Indiana and Wisconsin have made it easier to buy a gun than going the other way. But to everyone's work, Chuck's gun store in my district that crime guns have been associated with, they are now closed.
Woo!
So that is a great thing. But we need to make sure the legislation is enforced and see what else is needed.
Yeah, I would just add, I think there's one of these kind of things that I think about in terms of the cocktail party kind of stat that no matter where the person is from and you're interacting with them, they'll be shocked at this. And it relates to the trafficking issue. And I have to say, Congresswoman Kelly is the unprecedented expert on this in Congress and has done more than I think virtually any other member to really raise this issue and put forward legislation that would make a big difference. We have more gun dealers in the United States of America than we have McDonald's and Starbucks combined. About 5% of those dealers, so just 5%, are responsible for about 90% of the guns recovered in crime. That's a horrible, horrible statistic. It's also a hopeful one, because if you're a policymaker or a regulator, then you need to focus on those dealers that are materially contributing to gun death and injury. And under President Biden and leaders like Congresswoman Kelly, we were really starting to do that with Steve Dettelbach, who was the head of ATF, with the zero tolerance policy. We drastically increased the number of dealers we were inspecting, and we drastically increased the number that were being shut down permanently. They weren't being shut down and then going across the street. We were permanently shutting them down. And I think, Jen, the relationship between really focusing on trafficking, and look, our historical approach to this was let's go after the trigger pullers. We were ignoring all of the people who were supplying the firearms. That makes no sense. That doesn't work from a policy standpoint. And so I really think that if you want to be tough on crime, if you're a Republican or a Democrat or any affiliation whatsoever, if you're not focusing on regulating the industry that's selling the guns, then you're not helping to solve the problem. And as many people who can be informed about that and understand the solutions are right before us and they can actually really work, the better off we are. And it makes those community violence intervention dollars that have been invested actually give them a chance to really work, because you're not making it easier to acquire an unlawful gun than it is to get a bag of lettuce or a library card. And right now, that's how it is.
Absolutely. Yeah, I always think about access to firearms and success of community violence intervention programs as two sides of the same coin working together. I'm going to be cognizant of time. I know we're probably, am I going to get the hook soon? 10 minutes? Okay, great, amazing, okay. No one wants to see us coming at their cocktail party. But we'll have lots of fun facts for you. So, one of the updates that happened this week, unfortunately, I know we talked about some good news in your speech in terms of the SCOTUS case, 7-2. But unfortunately, of course, the House Judiciary Committee did vote out the Conceal Carry Reciprocity Act. Now, that's a lot of words, and I want to know from everyone here, what is that, and what would it mean for our states and our communities?
Okay. It would mean that, let's say in Georgia, you have a license to carry a gun, then you could come to, or conceal carry, and maybe in Illinois, we were the last state to allow concealed carry, but there are some states that have open concealed carry. We don't have that, but it would allow, if you have that permission in your state, you could go to another state that doesn't have it, and you would have reciprocity. Because I remember one member, I'm saying Georgia, because he said, my wife has a gun legally in using it the right way. But she wanted to bring it to Washington, D.C., and she can't do that. But now it would allow her to travel with that gun, even in places that, you can't have open concealed carry. But now you would have permission to do that, which would be, in my book, horrible. And it's interesting. We feel like there needs to be, the federal government needs to step in so there's one law across the whole United States, because that's the problem, all this patchwork. And the law should be that you cannot do that. And it's interesting because sometimes my colleagues on the other side, they're states' rights, states' rights, states' rights, but they're willing to take away the states' rights of Illinois and New York and Connecticut and New Jersey, to let the gun folks, bring their guns.
That's right. That's
So
right.
you can add more, whatever I left out.
No, you summarized it beautifully, which is to say horribly in terms of the impact of this. I just think one of the things that they've done here is find a solution to a problem that doesn't exist. And the reality is for those states that do have decent permitting systems, which is about half, to carry a gun in any manner, whether that's open or concealed, a lot of that has to do with training and making sure that you have all of the right skills and understanding. And we know from the research that's out there, it's those kinds of requirements through permitting systems in combination with strong BRADY background checks. States that have that combination of laws see far fewer gun deaths and injury than other states. So they're upending, in one fell swoop, this is what she's saying about states' rights, in one fell swoop, any state that has made an effort to put those kind of permitting systems in place, they go away. And think about what this means for a law enforcement officer. Basically what you're saying, in a moment that's rather challenging, right? Let's say you're a DC cop and you have folks making their way to the United States Capitol. And
Which
it's
they did do
January
that.
6th.
Yeah.
And you see that the person might have a firearm. What this is saying, because it's not just, it's bad enough that it's saying, well, it's upturning all of the other permitting systems. It shifts the balance of inquiry. It says that you as a police officer can be sued if you don't have probable cause to know that that person is actually not permitted to have a gun. It's a perverse piece of legislation. When I read it 4 days ago, I called the team and said, is it as bad as I think? And they said yes. So basically it's why every law enforcement group across the country has come out a little behind the scenes to say, please do not do this. It puts our officers at risk, puts public safety at risk. Think about a place like DC. You can't carry a gun concealed without a permit. It has all of these requirements, and you can't from out of state. This would upend all of that in a dramatic way. So it's very, very dangerous. We are opposed to it. We understand behind the scenes, some Republican members are saying to leadership, please don't bring this up for a vote. This will be very bad. I hope that's true.
Well, I'm sure they're saying it behind closed doors, but we need them to speak up. Enough of that behind. There's a lot of things they don't like behind closed doors that are going on, but when the vote comes, but the one thing is, even if it passes in the House, they still need 7 Democrats, to help them in the Senate, so.
Yeah, I mean, essentially this creates yet another loophole, for people to kind of evade. It's just terrible.
Yeah, that's a great point. So I'm going to end our last question on a community question. It was actually sent in. And so, Joe, it's your day. So you're going to get to answer it, our last question, which is actually about offices of gun violence prevention. It's a growing trend in states. It was once a growing trend in this very capital. What are some of the highlights from or about offices of gun violence prevention? And moving forward, what are some ways that state office can work to achieve some of these goals and objectives that we talked about tonight?
Well, great. I'm glad you're asking me this because I'm going to throw it back at you in a second since you're leading a state office. But I think it's really important. So I highlighted briefly, the White House office that so many of us push for. And I just want to make a couple points about that and how critical it was. First is the reason we pushed for it to be in the executive office was because of convening power. We knew that all the agencies, right, as everyone knows, they're so busy that if you drop it in the health department or justice, they're not going to have the ability to bring people, to the table. And so I think that was critical. So what did it do, even though it doesn't exist anymore? It had, I think, such a powerful impact in a short amount of time. It was, was signed in September of 2023. And the reason it did is because they brought in survivors, right? They worked with someone, Steph Feldman had been working on this issue since Sandy Hook. And they provided a couple things that I think are critical. One is they essentially came up with a bunch of ideas, right, as you know, on things that we could be doing. Some of which, needed kind of legislative effort, some through executive action, but also other aspects through local and state, providing that technical kind of expertise to folks at the state level of, hey, how can you use these ARPA dollars? What happens with the funding from the Bipartisan Safer Communities Act? And so they literally were going down a checklist of things to be able to ensure that we were shoring up all these holes that existed. I mean, Medicaid, right, dollars for violence prevention is an example. The work with the Surgeon General's office, and the impetus to get other states to understand the value of creating their own offices. So there is a bidirectional flow that exists from the state level to the federal level and vice versa. And of course, I think Maryland was one of those states, right? And we're grateful that, of course, there was a lot of advocacy before, but I think, as you've pointed out before, that White House office really helped in that effort. And I think it'd be, I know you're like just in your role, but I think it'd be great for people to hear, already, even in such a short amount of time, how you all are thinking about this and how you all have been impacted by, what's happened kind of nationally.
Yeah, absolutely. And I think you're absolutely right about the impact of the White House office and how it's having in states all over the country. And I think one of the things about that is knowing that, it doesn't necessarily need to be a state like Maryland where it's incredibly progressive. Offices of gun violence prevention are being, created in states like Wisconsin and North Carolina, in Pennsylvania. Some of these are being done by executive order, and so you don't necessarily, have to live in, Illinois and Maryland to be able to use this solution. And you also don't need to focus on, what laws can we pass, but figuring out how to be innovative in utilizing the tools that the states already have. Becoming a convener for different state agencies. Bringing together everyone so we could, really look at these issues comprehensively and holistically. How do we look at data in a better way? How do we, and my Center for Fire and Violence Prevention and Intervention is housed at the health department. But it doesn't have to be to work with health departments to be able to gather the correct data so that you can look at it in a really timely manner. And beyond just mortality data and non-fatal data, but working together with the police departments to get public safety and gun trafficking data, working with the Department of Juvenile Services and finding out about youth who are most at risk. So there's so much that we can do in our states in a variety of political climates. And these offices have the tools to be that hub, to help come up with these ideas, to bring people together, and to pull together data, pull together the right players, and then come up with solutions that are really going to change our state and our country, I think, in more ways than anyone could have imagined. When I came into this issue space, 10, 12 years ago. So I have a lot of hope right now. Yeah.
Yeah, I think that's a great point. There's, I think last time I checked, 12 states that have opened
That's right.
offices across the country. And I think it's just a testament to kind of what was done nationally, but people also seeing the opportunity that exists, for people within their community. So I think you summarized that nicely.
Yeah, and the White House has put together a legacy for all of us, and we're going to work together to continue it. So I want to give everyone in under 30 seconds, you can do it, what is one thing that you want to leave with everyone tonight as they go home and go forth into changing their own communities? Under 30 seconds. All right, Representative Kelly?
Well, I'm an optimist, so I couldn't do this job, but I just want you to know that every person can make a difference in your way. Reaching out to young people, investing in young people. I had someone that started Kids Off the Block, and she just invited kids into her home, even if it's getting to know your neighbors and being there for your neighbors. There's simple things that you can do, but also get involved and know what's going on in your community. I think that's really important.
Perfect.
I'll just echo that. I always think these days about spheres of influence, and there are a lot of different ways you can get engaged. The things that you can do in your neighborhood, the things that you can do at your schools, there's things that you can do at the state level. I know, hearing from a lot of people, even calling Congress makes a big difference. And so really think about your opportunities at the very, very local level, at the state level, and at the federal level to make a big difference. And think like Representative Kelly, too. I mean, you can call your local radio station and say, why aren't you playing End Family Fire ads, for example, right? So there's all kinds of things, and just inform yourself, go out there. There's a lot of different great things happening. Do some research, find out where you want to get involved, and then get involved.
She didn't say this, and support organizations like BRADY.
Thank you.
I think two quick things. One is, I would say, not to lose hope. I think it's very easy in this time when things are so chaotic, where we can lose hope. And I just think it's so important that we don't lose that. I think the other piece, to kind of riff a little bit off my incredible panelists, is the collective action that exists among all of us. A lot of times we see these very complex issues on the shoulders of a few people. And I think if we all recognize the fact that each and every one of us can be part of the solution, it disseminates that burden that exists. So not one person is kind of carrying all the weight. And I think that's so important and critical. And everyone is going to, I think, engage and intervene in their own way, and that's okay. But collectively, I think if we do that, then we're able to really move that needle forward.
Yeah, absolutely. Well, thank you, and let's go change the world.
Thank you.